Welcome to the ASC Podcast with John Goehle, the longest-running podcast specifically focused on the freestanding ambulatory surgery industry. We would like to thank our sponsors, Surgical Information Systems, providing cutting-edge information solutions for surgery providers, RFX Solutions, your all-in-one healthcare regulatory compliance software, MedServe, which is the only digital narcotic cabinet specifically designed and priced for surgery centers, helping standardize processes, compliance, eliminate paper logs, and prevent drug diversion, and Ambulatory Healthcare Strategies, the nation's leading regulatory and accreditation compliance resource for ambulatory surgery centers. For more information about our sponsors, please visit our website at ascpodcast.com.
Welcome to this special episode of the ASC Podcast with John Goehle, recorded on May 2, 2025, from ASCA 2025 Conference and Expo at the Gaylord Rockies Resort and Convention Center in Aurora, Colorado. This is episode 245 of the longest-running podcast in the ASC industry. I'm Mary DeMauro, your guest co-host for this episode. As a reminder, the regulatory landscape for ASCs is constantly changing. The content in this episode reflects the most current information available at the time of recording. We encourage all ASCs to remain vigilant and keep up with any updates or new guidelines released by relevant regulatory authorities. And now, I would like to introduce the podcast host, John Goehle.
Thank you so much, Mary. Mary is one of my dearest friends. We should have applause, but you wouldn't hear it on the microphone here. Mary is one of my dearest friends from many years ago. She's my hero. When she retired, she actually retired. Many of you know that a lot of us in this industry, including many of my employees, have retired and then still are working right now. But Mary has actually done that. But she's here because she does keep up with what's going on in the industry. And it's such a pleasure to have you with us. Thank you. And so we're here, getting ready for the big party tonight where we're all going to have some fun. And I've got a great crowd. I'm not going to run around and have everybody introduce themselves. What I'm going to have you do is before you answer a question, just say who you are and who you're with, okay? So with that, let's ask some question. By the way, when you introduce yourselves, introduce your name and your role. So my first question, I love this question. What is the most impactful session you have attended over the past 2 days? So think back on all of the sessions you've attended. What's the one that has been most impactful to you?
Hi, John. Kim Falone, Niagara Ambulatory Surgery Center Administrator. I just went to a session earlier today. It was Casey Duhart, and she's an HR specialist, and she did presentation on investigations and rightfully terminating and how to document issues and all sorts of things, which was very helpful for me because we don't have an HR department, so we had to stay up on all of these regulations and proper documentation. So she went over how to write up a good investigation when there's an employee complaint, and not to take, if somebody comes to you venting, not to take that lightly, to actually document it because it could be the beginning of a real lawsuit. So she was really insightful, and it was a great presentation.
I think human resources is one of our more challenging issues nowadays, because we're trying to maintain staff, we're trying to keep them on board. And any types of issues we have, we really need to take care of them before things, get bad. So that's a great idea.
Hi, I'm Kathy Hickman, Administrator for Dutchess Ambulatory Surgical. I thought Deborah Stitchcomb and William Miller at the Risk Assessment Seminar were fabulous because something that we take for granted, handwriting in a chart. Illegible handwriting can make the entire difference in a settlement. And they demonstrated how just the way someone wrote something made the jury go a whole different direction in terms of their decision. And who would think something that simple? And they had the best ending of it. The medical record is your best enemy or your worst enemy. I thought that was a nice little takeaway from that seminar.
So I have an interesting question. Did they talk about whether they like paper records or electronic medical records?
They didn't actually say which one they liked, but they definitely had slides pertinent to each set because they each had their own concerns, and that's why with handwriting was one, but the clicking in the EMR was another. So he definitely, discerned the difference between the both.
Gotcha.
My name's Tony Lyons. I'm a financial specialist at AHS, Ambulatory Healthcare Strategies, and this is a little gratuitous, but it was a session with John Goehle on Finance 101. And of course, I always, I speak that language, but I could see the impact on the participants. It was well attended, and the questions became very interactive. Good questions, and many questions you can see that the audience just didn't understand the language and their desire and need, really, their need to. And then the line afterwards of questions and discussion was, of course, quite long, and would have been longer if people didn't see such a long line, I'm sure. And I thought it was very relevant and really important for administrators as well as nurses to understand the financial language and really how to use financial analysis to improve their centers. So, and it was really a very good session.
And of course, Tony helped me out because he was my memory bank to remind me of those things that I forgot about. Tony, it does bring up an interesting point that I found is that as a speaker, and again, now I'm talking to prospective speakers in the future, and kind of a lesson for all of you who have ever thought about speaking in public, getting over that fear of being in front of a crowd is actually the easier part. The tougher part is learning how to engage with your audience. And you want to have a good audience. I had such an incredible audience. And the engagement, the ability to ask those questions. It is tough sometimes to, turn on a dime and be able to answer them. And then the second part, I think, of that was making sure that you don't let one person overtake the conversation, which unfortunately I was not very good at doing, I think, this time. So we have to be very careful about those situations. But having a great audience, listening to their questions really helps us to be able to identify, what we need to be talking about in future sessions, and it really helps us on that.
Hi, I'm Mary DeMauro, retired administrator for many years. And I think one of the most exciting sessions I attended was Unleash Your Full Leadership Potential with Jessica Bush. And she really drove home the lesson of you looking at you and reminding you that a good leader really is someone that has influence over everyone that you are over, the people you work with, the doctors you work with, everyone. If you show that, you have it. And that is demonstrated mostly by your character, and you have to have a good character. And if you do that, you have the chance to develop people. And as you develop people, you harness their pluses and their own character and allow to contribute and teach and expand their horizon and offer them opportunities in your organization.
So, I'm Mary. I worked with you for a good 15 years before you retired, and I think I just want to call you out for doing the transition properly. Both when you came on board as a new administrator, having a great mentor in the prior administrator, and especially when you transitioned your successor to that. And I think that gets to the heart of what you're talking about here, is that this is not an accident. Good leadership, good transitions are not an accident. There's something that happens because it's been well thought out. And that's one of the reasons I'd love to hear other people comment about that. That's one of the things that's fantastic about coming to sessions like this, because not only can you hear other people talking about how that is, but you can talk to other people that might have gone through it or going through it.
One of the most exciting things, this is Mary again, and when I did transition from a clinical manager position with a very, very busy, successful ASC to administrator, my administrator at the time nurtured me all along the way, and she actually she was almost a little bit burned out because she thought, oh my goodness, I don't think you want this job. And the light came on when one of my doctors came to me and said, look you have all the stuff that it takes to lead us, and you're going to be wonderful, except for let me just put this one thing in your head and make your decision. He said, do you want someone else coming in here that's never worked here and telling you what to do? And I looked at myself, I looked at him, and I said, I'm your woman. Thanks, John.
Let's stay in that for a minute. Anybody else have any comments about transitions? I'm looking at all of you. You've all been through transitions. Some of them have been traumatic. Some of them have not gone well. Who's got a story? Who's got a comment?
Hi, this is Lori Rodricks. I also work with John at Ambulatory Healthcare Strategies as the Director of Clinical Services, and I was the nursing director at a multi-specialty center, and fortunately, my prior center, I had a wonderful mentor who was the administrator there, and we worked very well together, clinical and administrative-wise. So when I was at this new center and the administrator there went to the doctor one day, and that afternoon we got the fax that said she's not coming back, I became the administrator in an hour. And if it wasn't for my experience and my prior employment, it would have been a lot scarier. But I had also had the foresight, for whatever reason, because I'm a weirdo, to have sat for the CASC exam prior to ever becoming an administrator. And that also helped quite a bit. But yeah, it was like that afternoon, guess what? You're not just the nurse director, you're the administrator. It's like, yes, do I get a raise? No.
We had a transition recently where an administrator went to lunch and never came back. And so, unfortunately it doesn't happen that often, but it was very traumatic. But to that end, there were people in that organization that maybe hadn't been trained to be that lead person. But my point being is that the organization had other individuals that were able to carry on. I mean, we had a very quick meeting, governing body meeting. We did all the stuff that had to be done, but people had been prepared, and I think maybe that's a good question for the group, and something, again, I want to tie it back to what you've been learning today. What are you doing in your organization to make sure that there's continuity? Whether it's going to be a retirement, like in Mary's case, or whether it's going to be somebody going out on maternity leave for a period of time that's an administrator, or somebody that has to have a major operation. Or the worst case scenario, somebody has something very traumatic that happens, and they literally, like in that situation, don't show up the next day for whatever reason. If we're going to do our job, we have to make sure that we're always prepared for this type of a situation. I think you've got a story.
Yes, John, I've been dealing with this for probably a long time, but the last couple months, really, I have my nurse managers out on maternity leave, and we have AAAHC coming in a month, and she's still going to be gone. So this has taught me I really have to cross-train. So now I have an assistant nurse manager that I've been training for the last couple months, but also with, we have SPD, and with the rules of SPD that you have to find a certified person, which we can't. So, and my SPD person has some health issues that she might be out with. So, cross-training LPNs to be able to jump into SPD. So, definitely my advice would be cross-train as much as possible, so you have the next expert if something happens with the first expert.
Let's go back to our initial question. What sessions, and let's expand it one bit here. What sessions or what conversation did you have with a colleague or a new colleague that was very impactful to you?
I'm Wendy with Idaho Gastroenterology Associates. Kind of a director, kind of stepping into administrator role, still learning that side of things. And I think I was here for the first podcast day, and I think on that day I had said, I wanted to help with culturing or motivating the team and having a good culture of employees on the team and how to do that. And I attended a couple really great sessions about how to do employee evaluations, how to interview, made some really great contacts with those speakers who are, saying, please email me. I will send you examples. I will reach out to you with kind of what we've done. And I think just examples of what they've done to encourage staff and help staff. And I think just those connections and those speakers that I've been able to hear from, and what our big struggle is right now with growth, has been very helpful for me.
As I've grown up in the industry and been coming to this conference for so long, those conversations that I've had and those post-conference conversation I've had have had a huge impact on my career, and those people will follow up. That's the great thing about this industry, right? Is that people do follow up. We give away. I'm looking at you, Kathleen. I'm talking. And I'm going to turn over for a second. But we give away so much to even our competitors. I'm thinking about your, the work that you do in your area of giving away to your competitors, and so talk a bit about perhaps your experience not only here. I mean, we can expand this a little bit of going to conferences and how you try to interface with people, after you leave.
Well, again, I've been attending ASCA quite some time, and I do agree that when we can get that information later from the vendors, that's key. But when we meet each other and say, here's my card, I can get that to you. It doesn't matter that you're not in my state. And, you can tweak it to your state rules and know your regulations. But it gives you the jumping off point, I think, to say, this is what you do in New York. Well, you know what? I can do it in Idaho, but let me just make sure my state regs support it. But we're always willing to share papers, something simple as policies, all of that. And I think that is priceless for seminars like this, especially for new people.
And I'm thinking about, when you have I always say, don't reinvent the wheel. You have a plan of correction that you have to do for a statement of deficiencies. Don't try to guess on it if you don't know the answer to that. Reach out to some of those people that you met. I can guarantee you they're going to help you. They're going to help you. It's probably, of course, do reach out to your consultants, but truthfully, many times you can get the right answer from somebody else out there. So again, getting back to that base question, what interaction or what have you seen as you've been here that had a real impact on you?
Hi, I'm Christina Norman, Director of Operations for Ambulatory Healthcare Strategies. So I think I have a unique perspective because I've had truly a full circle moment this year being at ASCA versus last year. So last year, I was more of the attendee side and, former administrator and now turned regulatory specialist for Ambulatory Healthcare Strategies. And in the past, I always, attended the sessions, and I sat in sessions with people like John and Lori. And, they were my mentors. I looked up to them. And, I always said that if I never did what I did in my past, being the administrator, I can't see myself doing anything other than that. So now fast forward to my current position, and now I'm on the opposite side, and I'm talking with people who are like myself and, helping them realize that there are people that can help them, and, that we've lived it, and we can help you find better ways to, create efficiency in your center, how to help teach your staff. And, I think that has been really impactful for me personally.
It's Lori again. You know what? And I'm not being paid for this commercial ad, but conferences like this are supported by the vendors, right? Some of people's worlds, podcasts, can be supported by the vendors. And I don't think that the attendees realize how much they can glean from those vendors if they just ask. Because, they're not just, no offense, used car salesmen. They're there to help you, right? It's important, and we forget that, and they're there for you, and they're willing to help, So yes, it is a paid for ad, but that's so important to think about. Anyone that's out there listening to John, that use your vendors. They can help in so many ways, and get that rapport with them. Because when you're in a bind, who are you going to call? If you don't have that relationship, I want to be able to pick up the phone and know that they're going to run to my center before the next center. And that's important, really. You're welcome.
I think one lesson we've learned both running a booth here and then walking around other booths here is how often our clients, our listeners, don't know the types of services that we offer. They just think that we're, whatever the last interaction with us was, that's all that we have. And I found that when I go around to some of our vendors. I think Jeffrey Flynn yesterday talked about he had just bought a brand new table and found out from a vendor there was an even better table, but it's too late because he already bought it. So I'm going to turn it over to our used car sales. No, I'm just kidding. I should point out, he is not a used car salesman, but our vendor representative here, Paul, talk a little bit about that.
No, I appreciate that, Lori, and you're absolutely right. Now, my name's Paul Dobblehoff. I'm Vice President of Sales with RFX Solutions. Now, RFX is regulatory and compliance software. I was meeting with two separate customers this week. Now one is a woman who's working on starting up a rural management company to help out surgery centers in rural areas. And one of the areas that she was looking for help with was some direct to employer negotiations, contract negotiations. Now, I have another customer who specializes in that. Now, these two people didn't know each other, and this has nothing to do with regulatory and compliance software, but I was able to connect these two people, and hopefully they can create a relationship that's going to be able to help one another out. So, there are many people like me who've been working in this ASC space for 10, 20 years that know a lot of people and can provide a lot of value beyond just what sign they're standing in front of. So I appreciate that opportunity to talk to all my friends here at ASCA as well.
I'm gonna go back to Wendy for a second, because Wendy was at our booth and she said, "John, do you know anybody that you can introduce me to that's in the GI space? You run a GI center. Can you tell us what happened like 5 minutes after that question?"
Right after that, someone walked up to the booth that you know and has worked with you in the past, took a boot camp class just like I have, and that's how I kind of got connected. And we exchanged business cards and chatted for a little bit, and I'm going to be reaching out to her on Monday and ask her the questions that I wanted to. So.
And again, these are things, you came here, you looked at your agenda, right? We all looked at our agenda and said, wait, these are the sessions we're going to go to. By the way, how many, raise their hands. I'll have to, how many people actually ended up attending all of the sessions that they thought they were going to attend based upon the original agenda, right? Except for, so generally what happens is because things evolve, you say, oh, wow, I just heard about this, or some other person said, I'm going into that session. I got dragged into Lori's session, because why do I want to go, attend a Lori session? But, my team said, you're going this way to heckle her, because we all wanted to heckle her together. But it was a great, and by the way, Lori, I just want to call you out. There was a great session about infection prevention, and you brought up some things. Again, I have been in this industry a long time. I'm a surveyor. I really didn't come there, as I was joking. But I learned so much because and there were a couple other surveyors in the room. I don't know if you noticed that. But we're there because your knowledge is different than our knowledge. So another takeaway that I have from this is I'm a finance guy and a regulatory guy. I went to an infection control session. I could go to those regulatory and finance things, but for the most part, probably wasn't going to learn as much as I did from Lori's session. Let's ask this question. What's the biggest surprise that you've had here? What surprised you? What didn't you expect? Or what perhaps something that impacted you in a way like, oh my goodness, this is one of the first things I'm going to have to do on Monday when I get back?
Hi, this is Kim Coos, Suffolk Surgery Center, Shirley, New York. I found the most interesting thing in more than one session was the mention of GT for everything. I am astonished that they're throwing technology like that into interpreting guidelines, regulations. I'm just amazed. So I'm very, eager to go give it a shot and see. I've never used ChatGPT before. I don't even know what it is. I can't even. What is it? GPT.
GPT.
See, and yeah, And, I can attend so many of your finance sessions because each time I go, I have a little bit more of a foundation and then I build on it. I too, when I first started coming, would gravitate towards everything that had to do with me and what I did from day to day.
The stuff that was comfortable to you.
Yeah. So now I have to I force myself to go out and each time I come back with a little more knowledge, and then I gain more knowledge because I build on what I had. But again, what chat GPT is something new for me. So I would take heed to that because it seems like that's the way everything's going. That was very interesting to me.
So I had an opportunity to talk to Christina Benton before she left, a good friend of Lori Rodricks and I, who is no stranger to the podcast, no stranger to our educational programs here. And she was kind of in a hurry to leave, but she said, John, I was working with an organization that they hired a company that uses artificial intelligence to audit coding and billing. And I think, I'm not absolutely sure. Lori, I heard this too.
So basically what happened was she was working with an organization doing auditing. And they brought in this AI company who said, we found $100,000 that wasn't found by, the humans. And so she was doing auditing, and another company was doing auditing as well for this group. So they gave her some of the other companies' work for her to audit and vice versa. And they discovered that was not true, that the AI was incorrect. And of course, the facility would have gone with the AI because it would have been cheaper, but the coding would have been incorrect. And then in the long run, they might have had to undergo fines, etc. Because, you still have to, you can't trust everything because there's so much new and changes and whatnot that it's kind of difficult. But imagine that, $100,000 AI found as, they thought it was a win, and it was not. So that, I found that very interesting, John. She mentioned that to me as well.
So the takeaway here is when we're using these AI tools, be very careful about them. Question them. Look for So the secret to this is obviously to test AI to find out where it's getting this information. I found that very frequently, unfortunately, when I use ChatGPT or some of the alternatives, when I ask some very basic questions that I actually know the answer to. Unfortunately, it does often end up not being true, so be very careful about that.
To go back to what you were saying before about the vendors, I think it's so beneficial to come to these conferences to meet your vendors in person. Because, like an example, today, Judy and I were talking about an issue we had with CIS, and she had it at another center, and I'm like, we had that same issue. So the two of us walked over there together and described what was happening, and they were like, oh my God, we can fix this, And we had another issue with patient estimates not being correct, and I called support about it, and they said that they couldn't fix it. And then talking to the developer, he was like, oh no, that's totally fixable. It's just this, this, and this. So it's so good to meet those vendors. I spend a ton of time just on all of our current vendors, not looking for new ones because we don't want to spend more money, but to revisit, because a lot of times when you're setting up these systems, it's so complicated at first that you miss some of their capabilities. So I think I agree with you about the vendors and meeting with them.
Okay, now as we wrap things up, what are you going to do on Monday morning based upon something that happened here? Be it, related to a vendor, related to a interaction that you had, or something that you learned here that you're now going to take home and immediately act upon.
So to dovetail on everyone about networking and all the people that we can help each other. So John mentioned that his neighbor at the booth was this vendor that has reusable sharps containers. And I was so intrigued with that. So John and I walked over together, and he introduced me, and I met this gentleman, and I took his business card. And so Monday morning, I am going to get reusable sharps containers, because how wonderful is that for the environment and the fact that we're going to save a lot more money. So that is my first thing Monday morning, is order reusable sharps containers. And I learned that because John led me to them. So again, this is all that networking, even amongst ourselves. I'm so excited about that.
Can you share that information?
It's such a small thing. You may think I'm so excited about that.
Saving the environment and probably saving costs in the end. Yeah, in the end. Somebody else, anything you're going to do?
So the first thing I'm going to do Monday morning is I'm fixing our contracts in CIS so that the patient estimates are correct. And then I'm also calling Tony because I have some ideas about our financials and how to better report, and I want to work with Tony on that. And that was from one of your sessions. So working on that and definitely working on CIS is my two things I'm going to do.
Anybody else? Yes.
One of my big struggles in being thrown into the world of director of nursing and being a leader is just learning the regulatory environment. One of the sessions that I was able to sit in on had a panel of different surveyors for different accreditation organizations. See, I'm still learning. And you know, when I first started, I thought AAHC was it. I thought that was all there was. It was that and your state survey. And it was really great listening to everyone chat. And then AAHC, the person who was speaking on them, you know, mentioned some of the things that they offer and things that they can do to help with your survey. Our application is going to be opening in the next few weeks. And so he kind of gave some tips and pointers and what kind of comes out of the application if you fill everything out correctly. So just really kind of exploring the website and gaining some information on AAHC and their survey process. And I was able to stop by their booth, speaking of all the booths in the exhibit hall, and speak to someone who, she got my contact information. I had some other complicated questions and just kind of about our certain situation. And she is going to get with her coworker and get back to me on that. So looking forward to hearing from them too.
Was the speaker Dave an anesthesiologist?
Yes.
And did you go about 2 hours over the session time?
He tried. I think they said we have 1 minute. We have 1 minute.
Yeah, he walked out and he said he had just been kicked out of the room. So, yeah, Dave is fantastic. Dave Shapiro's his name. He's an anesthesiologist. He's actually going to be on a future episode of ours to talk a little bit about it, the anesthesia crisis. And I love you that you brought that up, Wendy, because you're so right. So many people don't know that you have a choice. I'm going to be visiting a lot of state associations over the next year, and one of the topics that people have been asking me to talk about is, what's the current trends in accreditation? And I don't know if you all read or heard about this, but while we're here, DNV announced that they will be starting to accredit surgery centers sometime in the fall of 2025. And DNV is from Norway, and the first, they accredit right now. They are actually the oldest accreditation organization in the world. They started by accrediting shipbuilders, which is a natural transition, of course, to healthcare. No, I'm kidding. But they have been in the States doing hospital surveys for a while. We actually have a number of hospital clients that use DNV. What I suspect what will happen, and this is news for those of you out there that are hospital-owned or hospital-affiliated surgery centers, you might find that if your hospital is affiliated with a DNV accredited organization, you might find some pressure to go to DNV after that. So there are now 5 organizations out there that can accredit your surgery center, and probably worth learning more about it. Does anybody else have a comment?
Hi, Kathy Fody from Ambulatory Healthcare Strategies. We were just talking about the different organizations, and I had the opportunity to speak with many attendees about AAHC, Joint Commission. I happen to have both sets of clients. And one of the questions was, well, what's the difference? And they're all just a little bit different, but I noticed this year in the 2025 Joint Commission standards, they're starting to align. The companies are starting to align more closely. So it's not going to be, well, we're going to go with this because it's easier, or they don't have this type of standards. Regulation is going to start becoming a little bit more and more cohesive, I think. So it's what works best for your center, I believe.
And one of the things that I talk about when I do these sessions is that the transition from one accreditation organization to another is not as difficult as you might think it is. Probably not something that if the accreditation organizations are listening to me want you to know, but it is definitely something to think about. Anybody have any last minute thoughts?
RFX had 100 plus leads to follow up on from ASCA, but I've been doing this long enough to know better to call a bunch of administrators that have been out of the office for 3 days on Monday morning. So I'll probably wait till Wednesday.
Good. And again, we also want to talk about the vendor experience and RFX. Paul, thank you for mentioning that. We at Ambulatory Healthcare Strategies have a lot to follow up. And I think Paul's right. We need to take his advice here and make sure we don't bother them right away at Monday morning at 8 o'clock.
It's a Wednesday.
I want to thank everybody. This has been an incredible conference. We are heading off to a party, which will really rock the event venue here, and there is axe throwing apparently going on. That's going to be interesting. Hopefully, there's some. This is going to be interesting. But I do want to thank everybody for participating. It was wonderful over the last 3 days to work with all of you. Hopefully, we've given you some great content, and more importantly, I want a couple takeaways. Come to these conferences. There's nothing like being in person to these things. If it's for the educational content, if it's for the interaction that you have with other people, which in my view is actually probably the best part of it, or lastly, the opportunity to interface, as Paul said, with the vendors here so that you can learn more. You can get so much out of an interaction where they can demonstrate their product, their equipment, etc., and actually have a one-to-one conversation with them. So take advantage of those things. And remember, we're past the pandemic now, and it's time to start getting out there as much as we can. Now, we do a lot of virtual conferences, of course, and those are still important, and there's things that you can't get away from. You have to do it in person, but as much as possible, please try to get away at least once a year, hopefully twice a year, once to the national conference and once to your status conference. And with that, ASC Podcast with John Goehle, signing off.
It's been a long day, and the surveyors just left, and you are exhausted. And looking at the list of items that you have to address, you wonder, how can I deal with this and still take care of my patients? More importantly, you wonder, how can I ever keep up with all of the regulations, standards, and accreditation requirements? How can I always be prepared for a survey and reduce my stress levels? Well, that's what Ambulatory Healthcare Strategies does, day in, day out. We become your outsourced regulatory and accreditation resource. We can maintain your policy manual, develop your education programs, help out with fire and disaster drills, do your risk assessments, oversee your quality improvement activities, help run your quality improvement meetings and governing body meetings, and we can even prepare your monthly or quarterly financial statements and help you figure out where you are financially. We are a retainer-based service. We don't take ownership. We don't charge based on your revenue. We have one fixed monthly fee, and we can tailor your services to your exact needs. So whether you're looking for help getting over a survey, preparing for a survey, or looking for a long-term relationship to assist you with your ongoing regulatory and/or financial needs, please give us a call at 585-594-1167 or email us at info@ahstrategies.com. That is info@ah-strategies.com, or visit our website at ah-strategies.com.
This episode of the ASC Podcast with John Goehle is sponsored by Surgical Information Systems, RFX Solutions, MedServ, and Ambulatory Healthcare Strategies. Surgical Information Systems provides cutting-edge information solutions for surgery providers. RFX Solutions is your all-in-one healthcare regulatory compliance software. MedServ, which offers the only digital narcotics cabinet specifically designed and priced for surgery centers, helping develop standardized processes and compliance, eliminate paper logs, and prevent drug diversion. And Ambulatory Healthcare Strategies is the nation's leading regulatory and accreditation compliance resource for ambulatory surgery centers. For more information about our sponsors, visit our website at ascpodcast.com. This podcast is an educational and operational tool and is not intended to be a comprehensive resource for all rules, regulations and standards that an ambulatory surgery center must meet. The advice provided should not be considered as, nor does it constitute legal advice or opinion. When reviewing specific situations involving legal and regulatory issues, attorneys and other professionals should be consulted. This has been a production of Eden Group Development. All rights are reserved. If you're interested in advertising or sponsoring the ASC Podcast with John Goehle, please email us at info@ascpodcast.com. We would love to hear your questions and comments. Please email us at comments@ascpodcast.com.